Let's talk about the first stage of labor and delivery. First, we'll go over the basics, and then we'll go over some of the stages. And I'm also going to share with you a memorization technique that you can use for this section and also for other topics as you're studying. So this kind of does double duty here. We're going to learn about the first stage of labor, but also learn a study technique in the process. Now, the basics. You need to know that the truest sign of labor is regular contractions. Just because the water has broken does not mean that labor has started. It's very possible that the water breaks, but the baby is not born. Contractions never start. Obviously, that's a problem, but it is a possibility. So the truest sign of actual labor is regular contractions. You need to know that dilation is the opening of the cervix. It's the amount that the cervix is opening. Right? And it goes from 0 to 10 centimeters. Okay, 0 to 10 centimeters. So if it is 0 centimeters dilated, the dilation has not yet started. And if it's at 10 centimeters, then we know that they're fully dilated. Effacement is essentially the thinning of the cervix. Right? And it goes from thick to 100%. And one of the things that I learned previously that I thought was very helpful about what a thick cervix would be like is essentially like a gummy lifesaver, where it's thick and it's squishy, and there's just a real small hole in the center of it. That's what the cervix is typically going to look like. And then over time, throughout the first stage of labor, the cervix is going to be thinning to 100%. Station refers to the relationship of the fetal presenting part to mom's ischial spines. Okay, so the ischial spines are the tightest spot in the birth canal. And if the baby can't make it through the ischial spines, then the baby's not going to be born vaginally. Going to have a C-section. And so you can imagine the best way to memorize whether it's positive or negative, remember there's negatives and positives, or 0, right? You think of it this way. If you ask the mom, do you want to be positively giving birth or negatively giving birth right now? They're going to tell you that they want to be positively giving birth. So once the baby is at the ischial spines, that's at 0, and then when they get to +1, that means they are positively going through the ischial spines and are going to continue in a positive manner. So if you were to tell the mother that they are negative right now, then that is not a good thing, because the mother would most likely want that baby to be coming out. She's pretty much ready at this point. Now, lie. Lie refers to the relationship of the baby's spine and the mother's spine. Okay, and the spine of the baby is either going to be vertical or transverse. Okay, vertical is good. Transverse means sideways. So you don't want a sideways baby coming out, right? You don't want it to come out sideways. You want it to come out straight and vertical. Okay, so vertical is what we want. If it's transverse, it's going to be a little uncomfortable. Hopefully that baby rotates through the birth process. Last thing is the presentation. Presentation is the part of the baby that enters the birth canal first. Okay, there's a lot of different phrases and terms for describing the presentation, all the different letters and different acronyms and everything. Don't worry about all those, because nobody knows those. Okay, very few new graduate nurses know those, and it takes a ton of time to memorize all of them. Might they ask you about it on the NCLEX? Yes, you might see anything on the NCLEX. But since nobody else knows it, that makes it a really difficult question. And if you get really difficult questions wrong on the NCLEX, you're not going to get punished for that. Okay, they're going to ask you a slightly easier question next time, but you're not going to fail the exam for not knowing the official term for the presentation of the baby or what that means. Okay, because very few people know that, and it's a very specialized part of nursing that you're only going to see in labor and delivery if you're an L&D nurse. So if you get a question like that in the NCLEX, just move on from it. This is one of those sections where you need to consider whenever you're studying anything, ask yourself, do most new graduate nurses know this information or use it on the job, or do most of my classmates know all of these terms? And you're going to find when you ask yourself that about presentation of the baby, no new graduate nurses know that. Very few new graduate nurses use it on the job, and none of your classmates know it. So don't spend time studying that. Let's move on to the stages of labor. Now remember, there's 4 stages of labor, but the first stage has 3 phases. Okay, so the first stage of labor is the labor stage. It's where they're doing the work, right? Not as much work when the baby's coming out or the placenta's coming out or while they're recovering. The labor is the part working up to it. Okay, so stage 1 of labor has 3 phases. Okay, you have the latent phase, the active phase, and the transitional phase. LAT, right? L-A-T. LAT is also the first 3 letters of the first phase of the first stage, right? So stage 1 of labor has 3 phases: the latent, the active, and the transitional. Stage 2 is actually the delivery of the baby. That's when the baby comes out, just lasts a couple minutes. And then the delivery of the placenta is stage 3, happens shortly after delivery of the baby, usually, almost right away, but within, a handful of minutes. It's not happening an hour or 2 hours later. It's a pretty quick process. And then the 4th stage is recovery, and that's where the uterus is contracting, and this typically lasts for about 2 hours after the delivery of the placenta. Okay, the uterus is going to be contracting. It's going to be constricting all of those blood vessels and closing up all of those places where the placenta was connected to the uterine wall. So that recovery phase is crucial, and if it does not happen appropriately and the uterus does not contract appropriately, the mother has a high chance of hemorrhage, and that hemorrhage is not good, and therefore that 2 hours after the placental delivery, the mother is considered unstable for the first 2 hours. So after 2 hours are considered stable, and if they have had a cesarean section, yes, they had surgery, but they just used a block for that. They're not under general anesthesia, so it would just be a local, and therefore, the 12-hour rule for the stability framework doesn't apply. Just 2 hours on recovery, whether it's a vaginal or a cesarean birth. So let's talk about the 3 different phases of the first stage: the latent, the active, and the transitional. In the latent phase, the cervix is dilated 0 to 4 centimeters. So centimeter dilation is 0 to 4 for latent. The contractions are going to be every 5 to 30 minutes. That's how you know you're in the latent phase, 5 to 30 minutes. They are going to last, each contraction is going to last 15 to 30 seconds. And we would describe the contractions as mild. Mom, especially if she's a prima gravida, may disagree. Prima, remember, is first. So if it's her first delivery, she's definitely going to disagree that this is a mild contraction. Now, when she moves into the active phase of labor, she is going to be dilated 5 to 7 centimeters. The contractions are now going to be closer together. They're going to be 3 to 5 minutes apart, but they're going to be longer. Okay, so now they're going to be 30 to 60 seconds long, and they're going to increase in intensity. So now they're not mild anymore. Now they're moderate. In the active phase, the contractions are moderate. And then in the transitional phase, this is close. Baby is close. Okay, so now the cervix is dilated even further. So now it's 8 to 10 centimeters. The contractions are 2 to 3 minutes apart. Right? The contractions are lasting even longer. So they're closer together, 2 to 3 minutes apart, and they're 60 to 90 seconds long. Okay, so if mother's having a 90-second long contractions 2 minutes apart, there's only 30 seconds in between when the end of one contraction to the start of the next. So that's a pretty rigorous time of labor. That's why it's called labor. That's the work part. All right, and then these contractions are considered strong in the transitional phase. Okay, this baby is transitioning into the world. All right. So, like I said, if the contractions are lasting 90 seconds and the contractions are 2 minutes apart, so the start of one contraction to the start of the next is 2 minutes apart, but in the middle of that 2 minutes, 90 seconds of it is taken up with a contraction. Mom's only got 30 seconds of recovery time in there, and the fetus only has 30 seconds of recovery time. So we want to make sure that contractions should be no longer than 90 seconds or closer than every 2 minutes. Okay, so if that's the case, you're going to want to adjust any drug. Those are drugs that are being titrated right now. Perhaps notify the physician if possible. But the first thing you're always going to do is adjust the drugs if that is an option. Now, on that table that we just filled out that breaks down the different phases of the first stage of labor, I don't want you to memorize all that stuff. Okay, I want you to use critical thinking. Okay, so I want you to memorize only the center column, the active phase. Okay. Only memorize the active phase, because from that, you can deduce the latent and the transitional phases. Okay, so if you get this kind of question on the NCLEX, you got your whiteboard, your dry erase board. So what I want you to do is just write down the word active, and then below that, write 5 to 7 centimeters, 3 to 5 minutes, 30 to 60 seconds, and the word moderate. Okay, so then as you're going through this question, you can deduce whether the latent phase would be less dilated or more dilated than the active phase. And you would know that the latent phase comes first, so there will be less dilation. And you can fill down that column because the contractions are going to be further apart, and they're going to be shorter, and they're not going to be as intense. And then the same thing for deducing the transitional phase. From the active, you're going to know that the transitional phase, the dilation is greater, that the frequency is closer together, the length of the contractions, the duration of them is longer, and that they're more intense. So then when they ask you a question about this, they might give you some of these signs. They might give you the contraction frequency and the amount of dilation. So if they tell you that the contractions are 3 minutes apart and the cervix is 3 centimeters dilated, is that a problem? Well, I would tell you that yes, that's a problem, because you should use critical thinking and say, wow, if the contractions are 3 minutes apart, that means we're in the transitional phase. And if the transitional phase is the last part, well, we know that they should be 8 to 10 centimeters dilated. Well, if the baby's about to come out and there's only a 3 centimeter opening in the cervix, that's going to be a problem, right? So if they ask you, you're monitoring these 4 clients who are in the first stage of labor, which one should you notify the physician about? You're going to choose that one, right? Because that one is going to be a problem if that mother continues without having further dilation of the cervix, right? So likely everybody else is going to be within the appropriate corresponding signs and symptoms. And so you're going to want to choose that one that was an outlier. Okay, so that's where you want you to use your critical thinking. Don't memorize the whole table. Just memorize the active phase, deduce the latent and transitional, and then use your critical thinking to figure out the answers to these types of questions. So for assessment of the contractions, as I mentioned a minute ago, the frequency of the contractions, you measure from the start of one contraction to the start of the next contraction. From the start of one to the start of the next. That's the frequency of contractions. The duration is from the start of one contraction to the finish of one contraction. So from the start to the finish of one contraction. And then the intensity is going to be the strength of the contraction. And you're going to palpate that with your fingertips on the fundus. Okay, so you just use one hand, and you probably use your dominant hand because most people have their watch on the opposite hand. So you're going to be timing the contraction on your watch while you're looking at your watch, and then you're going to have your hand where you're feeling on the fundus as you're calculating the intensity and the duration and frequency of those contractions. So that's really what you need to know about the first stage of labor and delivery. Again, use this study strategy and technique on other topics that you're studying for the NCLEX. If you have a table like this and you can memorize one section and deduce the rest, then do that. Okay, don't memorize the entire table. Labor and delivery questions are showing up much less on the NCLEX because, as I mentioned previously, it is a fairly specialized part of nursing, and this is a lot of stuff that you're going to be using on the job and learning on the job and honing those skills, and not a lot of new graduate nurses are doing this, so it doesn't show up as frequently on the NCLEX. Because remember, the questions on the NCLEX come from surveys completed by new graduate RNs out in the field, and they do a practice analysis survey. So the NCLEX-PN sends them out the survey, and new graduate nurses say, check a bunch of boxes and say, this is the stuff that I'm doing on a regular basis, this is the stuff that's important, and this is the stuff that I'm doing frequently, and that's the stuff that gets tested. Well, since not a lot of people go into labor and delivery, when you think of an entire hospital operation, all of the different areas of healthcare where new graduate nurses are working, labor and delivery is a pretty small section, right? So you're not going to see a ton of these questions, but they are things that are important to know. So there you go, labor and delivery for the NCLEX.